So, if you've just started blood pressure medication, you might know exactly what I'm talking about. That weird, disorienting, blurry start to the day. Well, stick with me because in the next few minutes, we're going to give you a super clear plan to manage it.
And look, that feeling, it is not just you, I promise. It's a really common experience. But hey, that doesn't make it any less unsettling, right? It's that sudden sense of fragility right in that first hour of the day that can just throw everything off.
Okay, so our goal here is to move right past that anxiety. We're going to give you a practical system, a way to really understand the timing of it all, sort through your symptoms, and maybe most importantly, have a much more productive conversation with your doctor. All right, first question. Why are mornings the absolute worst for this? Well, it's usually a timing and transition problem. See, your blood pressure naturally dips overnight while you're sleeping. Then, bam, you stand up, and your body has to adapt fast. If it lags even a little bit, that's when you get that head rush or blurry vision, especially if you're even a little bit dehydrated. Okay, let's really dive into this next part, because honestly, this might be the most important distinction you can possibly make. Knowing the difference, and I mean really knowing the difference, between a manageable side effect and a true emergency, well, that's what gives you control and keeps you safe. So, take a look at this. We're drawing a really critical line in the sand here. On one side, you've got your manageable side effects. Things like a brief, blurry feeling when you stand up that, crucially, goes away when you sit back down. These are things you need to report, for sure, but you can monitor them. But then, on the other side, we have the true emergencies. And listen, when it comes to these red flags, there is absolutely zero ambiguity. If you experience a sudden blackout in your vision, like a curtain coming down, or any signs of a stroke, like a face droop or arm weakness or chest pain, or you actually faint, the only move, the only one, is to call 911 immediately. Don't wait, don't try to observe it, just make the call. Okay, so before we get to all the proactive stuff, what you should do, it's just as important to cover what not to do. Seriously, just avoiding these common reactions is a huge part of staying safe, especially in that first tricky week of new symptoms. Mistake number one, and it's the biggest one, stopping your medication on your own. I get it. It feels like a decisive way to solve the problem, right? But it can cause a really dangerous rebound in your blood pressure. Just never do this without talking to your doctor first. Promise? All right, mistake number two is just kind of waiting to see what happens without writing anything down. Look, without a simple log of when your symptoms are hitting, your doctor is basically flying blind. They absolutely need to see that pattern to figure out how to help you. Oh man, this next one is huge. Low fluid volume, which is just a fancy way of saying you're not hydrated enough, can dramatically, and I mean dramatically, worsen dizziness when you're on these meds. It's like the perfect storm, an empty tank and a quick movement. This next one, it has to be a non-negotiable rule. If your vision is blurry, if you feel unsteady at all, you do not get behind the wheel of a car. Period. It is simply not worth the risk to you or to anyone else on the road. You also got to be a little careful in that cold and flu aisle. Some of those common over-the-counter decongestants can actually raise your blood pressure or mess with your medication. Your best bet? Always check with your pharmacist first. And what if you miss a dose? It happens. But whatever you do, don't try to play catch-up by doubling the next one. That is just a recipe for trouble. Your job is to follow the plan your doctor gave you, not to start improvising with your dosage. And finally, let's talk about data. Because bad data leads to bad decisions and a whole lot of unnecessary stress. Rushing your blood pressure readings, using the wrong size cuff, or checking it right after you've run up the stairs, all that's going to do is give you these dramatic numbers that cause a ton of anxiety for no reason. Okay, now that we know what to avoid, let's flip this around and focus on a really powerful proactive step. This is how you're going to turn that confusing, blurry feeling into clear, actionable data for your doctor. So how do you get real answers from your doctor? Well, you get real answers by asking better questions, and you ask better questions when they're backed by good data. See, a symptom log isn't some boring chore. It's the key that unlocks a more precise adjustment from your doctor. It's what gets you feeling better faster. And check this out. Here's what that log can look like. It is so simple. All you really need to track is the time you took your dose, when you stood up, what the symptom was, how long it lasted, and, if you can, your blood pressure at the time. This simple chart right here gives your doctor the exact pattern they need to see to help you out.
Right, so the crucial part now is turning this data into a daily practice. This isn't about being perfect or doing anything heroic. It's about building a simple, choreographed routine that minimizes your risk and gives you back control of your mornings. That's the goal. So this is your new morning sequence. It's 3 simple steps. First, wake up and just sit on the edge of the bed for a minute or 2. Don't jump up. Second, pause. Just check in with your body. How do you feel? And third, and only then, stand up slowly. This gives your whole circulation system time to adjust. And I want you to think of this next part as your personal safety gate before you start your day. Before you even think about driving, tackling stairs, or running errands, just run through this quick 20-second check. Is your vision blurry right now? Have you been dizzy at all? Any near falls? A yes to any of these just means you scale back your plans for a bit and prioritize being safe. You know, this quote really sums it all up perfectly. Your job is not to become your own cardiologist before breakfast. Your job is to run a safe routine, capture clean data, and escalate at the right threshold. That's it. That is practical, real-world control. So, that leaves us with one final thought. Forget about starting someday. This starts now. When you wake up tomorrow morning, what's going to be the very first thing you write down in your new log?